Materials used for denture base is the title for this week lecture. Uh, the denture-based material is essential to classify. There are many theories regarding the classification of denture-based material, whether they are depend on the type of the material or the technique that used to create the denture, or probably the procedures or the type of material in term of activation, or the type of material in term of belong to whether for metallic, non-metallic in term of polymers and resins. So generally, the denture-based material is that material used to contact the oral tissues and support the artificial teeth. And as I mentioned, the classification of denture base based on many theories regarding the type of the material, the technique used, the activation mode. Basically, all the information related to the base material depends on the manufacturers in terms of using material, polymeric materials, metallic materials, or resin material, and thermopressing materials. So this is depend on the supplier, the form of the material on which the supplier will supply for the customers. Now, the requirements of an ideal denture-based material is the any denture-based material should follow an ideal denture-based material. Yet we don't have an ideal dental or denture-based material. However, we have an acceptable denture-based material. So the accuracy of adaptation to tissue with low volume change is the main factor, as we are looking for accurate material with a less dimensional change. The dense of the material, non-irritant surface capable to receiving, and for example, it should maintaining good finish. That means when we are finishing the denture or the denture-based material, the susceptibility of such a material to any deformation or any change in the color, or in term of capable of having any scratches, this will be minimal. Okay. Now, also the biological compatible with tissue. The material should be compatible with the tissues. We don't say inert material or biomedical, but it is biologically compatible. That means do not irritate, do not affect the tissue in terms of carcinogenic effect, irritating in terms of creating soreness or tumor or whatever. Now, the thermal conductivity, it is essential as well as one of the requirements to replace the teeth and the surrounding tissues, is to make the patient feeling the same way that before the construction of such appliance. So the thermal conductivity should be acceptable. We don't looking for material with low thermal conductivity, so the patient probably drinking hot water, this effect cannot be filled with the sense of cold or heat until it's become on the esophagus, and this will burn the soft tissue behind the dorsum of the tongue. Now, low specific gravity, lightness in mouth, the appliance should be light, not bulky. The patient should feel comfort with the restoration made of such a material. Aesthetically acceptable. We are not looking for darkness material or lightness material in terms of aesthetic, rather than it should be compatible with the tissue of the patient, compatible with the color of the gingiva, with the color of the adjacent teeth, if there are adjacent teeth, in terms of removable partial denture. It should be dimensional stable. That means when we left it, for example, for 1, 2, 3 hours, this will not affect the material. cannot, dimensionally disturb in terms of maybe absorbing water or dryness within a limited time should be acceptable with the dimensional stability. Sufficient strength, that means resistant to fracture and distortion in terms of the patient with the complete denture, for example, or any denture, they are probably handling the material in terms of hard or drop it in the hard objects. So the material of the denture base should resist the fracture. Otherwise, that maybe have an appliance or denture after meanwhile fractured or need to be repaired every time. This will affect actually the details of the denture in terms of accuracy and fitness inside the patient mouth. And of course, resist deformation. That means the material is surface hard and do not flexible or can be banished. Self-cleaning, that means the material can be easily be cleaned. Low cost, of course, all the patients looking for low cost denture-based material, and this is depend on the variation between the customers. Many customers looking for probably highly cost material with a long shelf, long standing and successful denture. Many patients prefer low cost regardless the properties of the material, so should be low or acceptably appropriate cost. Potentially for future relining, that means the denture base should be probably reline. In terms of replacing the teeth and surrounding tissue, there is an exerting force which is not as usual, and this probably lead to resorption of the bone within 3 to 6 months. So the denture-based material should be easily to be relined. Now, whether these materials, in maybe in the old ways, we have new materials provide better properties. Probably the relining or rebasing procedure may be limited in the future because of the properties of such a material. However, mostly the material that we are using, according to the types of the denture materials, we can classify the denture-based material basically to the plastic material and metallic material. Now, the plastic materials either as a resin, polymer, and compact material. All of these, why they are plastic? Because they either, for example, acrylic resin, it's either heat cured or cold cured or light cured or Bourdon cured. It's in term of mixing. The plastic material also, like a polymers, thermopress, they are coming in a pellets or granules like this and can be heated and thermopressed in terms of thermopressing to be created. Now we have injectable in terms of dough and under the hydro flask controlled pressured curing the material can be pressed, and also milled blanks, for example, milled blanks, whether in one color or two colors, as a disc. These all as a polymers can be molded. We have the flexible, for example, compact polystyrene and veloplast. These are also in term of material coming in compact, and they are flexible material. Also, we have the metal. In term of complete denture, we have a full pellet metal to give a thin. In term of shallow pellet, we cannot use, for example, the resin, acrylic, or other polymers, because we need the thickness of 3 millimeter as a maximum. Then with the metal, we can, for example, have 0.8 millimeter thickness. We can use the metal. In terms of metals, we can use gold, cobalt, chromium, titanium, vanadium. All of these can be used as a denture-based material. Now, for example, the metal denture base designed with optimum extension, of course, thinner base, thin plastic resin, avoid sharp margins. The accuracy and dimensional stability for the metal, we have a minimal warpage, the casting imbibition. That's we the material do not absorb water, but probably maybe there are ion release in terms of consuming alcoholic or vinegars or any acidic solutions. Now, minimum need for posterior palatal seal area. Why? Because probably the fitness of the food dam in this term perfect for the metal, and minimum of course abrasion because the metal is hardened than the acrylic. The comparative response, of course, for the metal is the inherent cleanness of the cast metal base contributes to health of the oral tissues. The We don't have porosity such that in the resin on which all the bacteria may be adhere to and accumulate. So, bacteriostatic activity, ionization and oxidization of the metal base may be affected by the consumer habits in terms of acidic liquids. Metal base naturally cleaner than the acrylic resin base because it can be polished easily, electrolytely, can be kept clean. But the stain on it, the adhering of the food staining on it can be easily removed. Rather, in comparison with the resin there is an inclusion in the stain within the porosity of the thickness of the resin. In terms of thermal conductivity, the temperature changes transmitting through metal to the underlying help to maintain the health of that tissue. We know that the thermal conductivity simulate and massaging the oral mucosa, so it is essential that the thermal conductivity could be must be acceptable with the denture-based material. So with the metal is better than the resin. The patient accepts metal more than the acrylic or the resin or other types of the denture-based material. The denture resin insulating property, the swallowing hot substances, probably improving thermal perception. This will lead the patient to detect the temperature before going to the throat. While in the dentures with the polymers, because of the poor thermal conductivity, this may be the patient consuming hot or cold drinks, which affect their throats before detecting the temperature. Now, the weight on the bulk in terms of metal alloy may be cast thinner than acrylic resin and still have adequate strength because of the behavior of the atomics of the metal rather than the chemical structure of the resins or the polymers. Certain situation demands use of acrylic denture base in terms of weight and bulk, of course. Now, what are the disadvantages of the metal base? For aesthetic, of course, the color of the gray color of the metallic is not acceptable. However, can be used for external or as a base in terms of um, away from the appearance point of view. Enhancement of retention not possible. Lack of weight of the metal base. This probably affect the retention of the restoration. The relining, of course, difficult because we cannot grind or shaving the inner surface of the metal, so this will be difficult. The restoration of normal facial contour cannot cannot be achieved. We can achieve that with the acrylic or polymeric in terms of contouring, for example, the contouring the labial shelves, the buccal shelves to give a contour for the facial, but with the metal cannot be achieved. Uh, Now, the acrylic denture base, on the other way, is the most common type, and comparing with the metal allows relining of the base to maintain mucosal support, of course. The indication for it is for the extension-based denture with the long span edentulous ridges. If we need relining, if we need a contouring restoration, it is essential to use a polymeric or resin denture-based material for this. Aesthetically, they are acceptable, and it's the same as the simulate the gingiva as well with all the filaments on it. Now, the disadvantages of the acrylic denture base, the dimensional stability warpage. That means probably if the patient by mistakenly leave it on bench on it may be dry after a while, so the fitness are buried, or if leave it in a long time in the water, this will lead to absorb water and the size of the denture will be larger than the fitting on the patient mouth. The lower strength, way resistant than the metal, is susceptible to fracture, and particularly in the lower, in the midline, because of the surface area. The porous for the material, even with the complete polymerization, still the resin have the susceptibility to have porous, which hygienically may increase the bacterial accumulation, the food staining on it, and this will affect the properties of the material itself. And of course, the low thermal conductivity. In terms of porosity, there are two types of porosity recognized with the polymeric or with the resin acrylic denture teeth. These are the construction porosity and the gaseous porosity. And the difference between them is for example, the contraction porosity occur when the monomer contracts by some 20% of its volume during processing, while the gaseous porosity occur due to the exothermic reaction of the polymeric, which could make the temperature of the resin to rise above 100 centigrade, which is the boiling temperature. So the contraction porosity in terms of powder to liquid ratio during the this affected consequently on the curing, and the gaseous porosity coming from the highly temperature. For example, if you are using a water bath and elevating the temperature into 100 centigrade within probably 15 minutes, this will lead to evaporate all the monomer within the resin, leading to gaseous porosity, and this can be easily be noticed after deflasking the complete denture or the denture based material after flasking procedure and curing procedure. If this temperature is exceeded before the polymerization process is completed, that means before the free radicals between the atoms and the monomers, in terms of the step of polymerization steadily and gradually, this will lead to gaseous porosity. Gaseous monomer will be formed, which is the cause of the gaseous porosity. It can be avoided by allowing the temperature to be raised in a low and controlled fashion, and that's why we are using the long and the short cycle. In terms of 3 hours, the polymerization will be gradually up to 74 centigrade, and then for 1 hour or 1 hour and a half for 90 centigrade, or overnight or long curing cycle, overnight cycle, or 8 hours, let the curing up to 74 for 8 hours. So the processing of polymerization between the atoms on the monomers and forming of free radicals and reunion again to polymerize, this will really produce a semi-perfect denture-based material in terms of resin with the minimal porosity within the framework. Now, polymerization should be carried out slowly to prevent gaseous porosity and under pressure to prevent contraction porosity. The contraction porosity, if you maybe noticed that within the cold cure acrylic, the mixing on bench, so without using pressure in terms of using hydro flask, that mean the ivomate, probably if you create a special tray, for example, and you mixing it, there is the contraction porosity will be raised because there is no pressure on the porosity during the auto polymerization of the acrylic, and that's why we have contraction porosity here while the gaseous porosity within the boiling water. Now, the mechanical properties, the tensile strength of acrylic resin is typically no more than 50 megapascal. The elastic modulus is low, the flexure modulus being in the region of 2200 to 2500 megapascal. The tensile is essential. In this stage, you should, of course, know what the difference between the tensile and the impact strength, the compact and the shear bond. All of these affect the denture in somehow with the different loads applied on it. So if we're exerting a closal load on the denture will tend to be flex into both sides, and this is what we are calling the tensile, and that's why the material should have a highly tensile strength material or acceptable according to the load applied, because we know that in the anterior teeth the load probably up to 30 kilo, and then this 50 kilo with the premolars to 90 kilo within the molar region could be the force uploaded. So the material should withstand or all of these forces. When it is combined with lack of fracture toughness, it's perhaps not surprising that denture is prone to fracture. Of course, the sudden or the lack of toughness, this lead to sudden drop of the denture on a hard object, affect the material, and then this will lead to a fracture. Now, other types of the denture material, we have valoplast or the flexible materials. This material launched in 1950s, flexible base resin, ideal for partial denture, who they are sensitive from metallic and sensitive also to metallic ion release, of course, and sensitive to the monomers of the polymethylene methacrylate. Now, aesthetically, yes, they are fully functional alternative to traditional cast metal-based removable partial denture. It is easy to fabricate also the clasps with them. The biocompatibility of this material, it's a biocompatible nylon and thermoplastic resin, flexible and stable. The color, shape and design of Valoplast blend easily with the natural appearance of gingiva, making prosthesis nearly visible, of course. The strength of Valoplast resin doesn't require a metal framework, eliminates metallic taste, of course. Now, enables denture to be fabricated thin enough, adequate occlusal clearance for tooth placement, Vitalium combination, better support and aesthetic as well. But still, because of the flexibility of this material, become to the aesthetic more than the functional effect. Now, the most important requirement for the denture base as well is the need for relining material to be relined. So the distal extension base made of material probably need for has been needed for the relining. Also, acrylic resin denture base material that can be relined are generally used. Now, loss of support, distal extension basis changes in residual ridge loss of occlusion. The loss of occlusal contact and rotation relining. All of these cases probably need to be relined, otherwise the excessive resorption of the bone will be affected, and we need instead of relining we will need probably to rebase the material and removing all the denture based material on it. Basically, this all what we have today for the denture based material. Nowadays, we have also different materials in terms of blanks. Techniques are more easily than the hand skills. There are machining to create denture in terms of using blank of one pink color or two colors. Now, the quiz for the next week to be prepared. What are the disadvantages of acrylic denture base material? And I would like you also to find to take care until the next week lecture. Thank you very much.